Ladies and gentlemen, good evening, and thank you once again for joining us for another COVID-19 update. Let me acknowledge the presence of the Permanent Secretary in the Ministry of Health, Wellness, and New Health Investment, Letitia Lestradwijk. Also with us, Principal Nursing Officer and Coordinator of the Government-Operated Quarantine Facility, Terrilla Ravalier. National Epidemiologist, Dr. Shalauddin Ahmeh. Environmental Health Officer, Ray Robinson. Our media partners, thank you once again for making the time to be with us this evening. We always begin our press briefings with statistics from Dr. Ahmeh, and tonight will be no different. Dr. Shalauddin Ahmeh, National Epidemiologist.
Thank you, Ms. Harry. Permanent Secretary of Ministry of Health, Wellness, and New Health Investment, Mrs. Letitia Lestradwijk. Mrs. Ravalier George, Principal Nursing Officer and Coordinator of Government and Operated Quarantine Facility, and Mr. Ray Robinson, Senior Environmental Health Officer. And good evening to everyone. So the number of confirmed cases of COVID-19 is 20. The 2 new cases are asymptomatic and doing well. They are still in the COVID treatment center. So far, number of contact identified, 39. 22 of them are negative, and 17 still pending. So as it stands, number of confirmed cases, 20. Number of active cases, 2. Total number of recovered cases, 18. Total death, 0. Total number of contacts identified from the last 2 cases, 39. Total number of contacts cleared, 22. And pending, 17 of them. Total number of PCR tests conducted so far, 2,077 of them. And total number of negative PCR results obtained, 2,057. I just want to go over with the protocol again in terms of the CARICOM bubble, low risk, high risk, medium risk, and high risk, and the requirements. I'm not going to go through the list of countries that fall within that categories. However, this is fluid situation. Those countries will change every week. So I'm just going to go over the recommendations or the requirement for each of those categories. With respect to countries within the CARICOM bubble, the requirements from each of those passengers or travelers coming to Dominica required following: risk assessment prior to and on entry, that is the health risk assessment that is done online. Rapid test upon arrival. If rapid test is negative, the traveler can proceed to immigration, baggage claim, and customs and permitted to leave the airport after clearance. If rapid test is positive, the traveler will proceed to the secondary screening where a PCR test will be done and await the results in a government-approved facility at the traveler's cost. Now, if PCR test is negative, then the traveler is discharged from the quarantine. And if you test positive on PCR, you are transferred to COVID isolation unit until deemed medically cleared by the health officials. Just to remind, in this category, there is no PCR test prior to arrival. So there is no PCR test, there is no test prior to arrival for this category. Now, countries from low risk or low risk countries, passengers coming from low risk countries are required following: a negative PCR result that is obtained within 24 to 72 hours prior to arrival, the health risk assessment prior to and on entry, rapid test upon arrival. If rapid test is negative, again, the traveler can proceed to the immigration and baggage claim and customs and permitted to leave the airport after clearance. Travelers will be monitored for 7 days at their place of residence. If rapid test is positive, the traveler will proceed to secondary screening area where a PCR test will be done and await the results in a government-approved facility. If PCR test is negative, then traveler is discharged from quarantine. And if PCR test is positive, then you are transferred to a COVID isolation unit and until the deemed medically cleared by the health officials. So that's a low risk travelers. The medium risk travelers required to do the again PCR test before they come in. So one has to have a negative PCR result that was taken within 24 to 72 hours prior to arrival. And the risk assessment prior to, that's the health risk assessment I'm talking about. One has to have a notification of the health risk assessment. And then on arrival, they will be tested using the rapid test kit. And if rapid test is negative, again, travelers are allowed to leave the airport. And if rapid test, and those travelers will be monitored for 14 days at their place of residence. Optional to 14-day monitoring, a PCR test can be done on day 5. If the result is negative, then there will be no further monitoring at place of residence. And if you test positive, then you have to, or you will be transferred to the COVID isolation unit. Now, difference between low risk and the medium risk is that travelers will be monitored for 14 days instead of 7 days as in low risk countries. However, there is an option for medium risk that if you want to do PCR test after 5 days and the result is negative, then there will be no further monitoring. Now, travelers coming from the high risk areas, the requirements are risk assessment prior to and on entry, a negative PCR result that was taken, meaning swab was taken within 24 to 72 hours prior to the arrival. A rapid diagnostic test will be administered on arrival. If the rapid test is positive, a PCR test will be administered immediately, and traveler will await the results in a government-approved facility. And if rapid test is negative, then traveler will be transported to a mandatory quarantine at a government-operated quarantine facility or government-certified private property for a minimum of 5 days at traveler's expense. A PCR test will then be administered to the traveler on day 5 after arrival. And individuals will be deemed medically cleared after PCR negative test on day 5 at the discretion of the health officials. So that's the general rule of these 4 categories of travelers coming to Dominica. I want to briefly touch on the questionnaire, challenges in questionnaire that you may face. Some of the travelers complained that they did not receive any code or they did not receive any confirmation. So this is due to incomplete submission of the questionnaire. If you leave out some mandatory field that has asterisks on it, then this problem or error can appear. There are other problems like not receiving any reply within 6 hours from your flight. So in that, the reason behind is that you do not receive the reply within 6 hours of your scheduled flight. It could be due to the network system error. So it could be either your end, that you don't have the network system operational, or there is a network failure in our side where the server is. Due to that reason, you may not receive the reply 6 hours from your flight. In that scenario, you are required to call the hotline, and then we will rectify the issue as soon as possible. Usually, notification sent out within 1 hour to 6 hours from the submission of the questionnaire. And those who require to submit and upload the PCR results, just know that without it, approval notification will not be issued. I also want to clarify the other issues that reasons for those who are denied. Reasons for those who are denied are on the basis of either no test done, or no test result uploaded, or only the rapid test done and uploaded, and expired PCR test. These are the only reasons that you are denied to come in, or your submission been declined, actually, I'm sorry. So this clarifies some of the issues with the questionnaire itself. So I hope this clarifies with the questionnaire and the protocol of requirement of these 4 classified groups, 4 categories of groups. So thank you for your attention and good evening.
And our thanks to Dr. Shalauddin Ahmeh, who is our national epidemiologist. As he mentioned, if you have any questions, if anything needs clarification, you are welcome to call the hotline. The hotline numbers 448-2151, 448-2153, 448-2156, 611-4325, or 1-800-219. Our next presenter this evening is responsible for much of what goes on at the government-operated quarantine facility, and that is the Principal Nursing Officer, Terrilla Ravalier.
Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Wyke, National Epidemiologist, Dr. Ahmeh, Environmental Health Officer, Ray Robinson, Moderator, Ms. Sheena Harry, media personnel, listening public, good evening to all. I am here to convey a brief update report on Dominica's government-operated quarantine facility located in Portsmouth. We at the Ministry of Health cannot stress enough that this pandemic should be of continuous great concern to each and every one of us. As there has been an uptick in the number of cases within the Caribbean, and Dominica is not immune. Also, there are still a lot of uncertainties as it relates to COVID-19. Therefore, quarantine is, I must say, a critical public health and safety measures here for us in Dominica. This measure is not meant to penalize anybody. Rather, quarantine is one of the foremost measures in preventing the spread of COVID-19, which is a clear demonstration of the Ministry of Health's collective public health rationale. At this time, permit me to share an overview of the quarantine facilities. From the 21st of March to today, 26 August, a little over 5 months now, a total of 864 persons have been admitted for quarantine at the facilities. 641 PCR tests has been conducted thus far. A total of 800 persons have been discharged to date. A total of 30 persons who entered illegally were admitted and discharged to police custody. 6 facilities have been occupied at one given time. To date, No positive cases have been reported from the facility. There are a total of 63 persons quarantined at present. One facility is currently being used. Some of the current management plans at the government-operated facilities are as follows. The facilities are manned by a very dedicated and capable team. There are doctors, nurses, community health aides, logistic personnel, accountant, data entry clerk, drivers, and domestic workers. Quarantine is at a cost to occupants. The fees presently are as follows. PCR test, EC dollars, $100 or US $40 per test. First night accommodation and sanitization fee, EC dollars, $400 or US $150 per person. Each additional night accommodation is at EC dollars, $225 or US $90. Rates per meal for breakfast, EC dollars, $15 or US $6. Lunch, EC dollars, $20 or US $8. Dinner, EC dollars, $20 or US $8. During person stay, they are assigned to a single separate room where they are expected to remain until they are discharged. An inventory of items in the room is conducted in person's presence. They may undergo PCR swab tests to determine their COVID-19 status. Their temperatures are taken and they are asked COVID-19 related questions daily. Free proper meals are provided in disposable containers. No pets are allowed. Some of the expectations from persons in quarantine. Persons are to remain in their rooms unless contacted by the medical professionals or others for the following: for temperature checks, meal collection, scheduled bedroom sanitization, disposals of your personal garbage, bill payment, and discharge. Persons are expected to not enter the rooms of other residents irrespective of relation. Not bathe in the pool or the sea based on your location. Must wear a mask to safeguard themselves and others when in communal areas such as the corridor or when in conversation with the medical professionals. Persons are to respect the property. Keep the rooms clean at all times. Make arrangements to have additional cleaning supplies, toiletries, and bedding delivered when needed. Persons in quarantine can also have family members and or friends deliver food of preferred choices and other needed personal supplies for their use. However, all items will be inspected by the police and the facility security before being delivered to person's room. This is done to avoid illicit and unnecessary items entering the facility. During delivery of items, persons will not be allowed to have any contact with family or friends. If allowed to make contact, this will definitely defeat the quarantine purpose. Ensure that your family and or friends know your room number to facilitate a smooth process for contact. Have your clothes laundered at a cost, or persons are encouraged to bring sufficient clothes and linen for the duration of their stay at the facility. On discharge, persons receive a document indicating that they have completed quarantine at the facility with a negative PCR test results, and also very clear instructions are given to persons who are discharged. Persons are expected to make arrangements for transportation to their homes through their families, friends, or taxi services. Assistance can be given by the staff in this area. To conclude, I urge the persons in the quarantine facility, those listening, to continue to comply and work with the staff. Always be respectful to the staff. Do not abuse the staff. Do not use offensive, threatening, or disrespectful language when speaking to the staff. These behaviors are unacceptable and will not be tolerated. Be practical with requests that you may have, so as we do our best to provide for your needs. Adhere to the rules and guidelines of the facilities. These are in place to protect you and others. And please, refrain from tampering with, and more so, removing or leaving with items that does not belong to you, however, that belongs to the facility. At all times, these rules are very essential and important for the maintenance of this facility. It has become very, very much important for the team, as we are willing to work and support you and to guard our country. So we urge you to always be considerate and think of others who may need the government quarantine services and facilities. I thank you.
And thank you to Terrilla Ravalier, who is the Principal Nursing Officer and Coordinator of the Government-Operated Quarantine Facility. I'd like to take this opportunity to thank all those who work at the Government Quarantine Facility. It is not an easy task. As you can imagine, there's a lot of anxiety associated with working in such a facility. So we commend you for your diligent efforts thus far. Next this evening, we welcome for the first time at our briefings, Environmental Health Officer Ray Robinson.
Permanent Secretary in the Ministry of Health, Wellness, New Health Investment, Mrs. Wyke, Principal Nursing Officer and Coordinator of Government-Operated Quarantine Facility, Ms. Ravalier, National Epidemiologist, Dr. Ahmeh, media partners, Ms. Harry, and the listening public. Good evening. We are facing a global health crisis unlike any we have ever experienced in Dominica and probably the world. One that is spreading human suffering, affecting the global economy, and creating a phenomenon known as the new normal. We have no choice but to face this beast head on. As part of primary health care, we at the Environmental Health Department have a critical role to play. This begins at the ports of entry, where teams of competent, motivated, dedicated environmental health officers are stationed. At the ports of entry, our role include boarding every flight coming in to ascertain the health of passengers on board, and that is done through the General Declaration of Health, which is signed by the captain. And once that is completed, then clearance is given for passengers to disembark. We also ensure that travelers wear masks and are observing physical distancing protocols at all times during the arrival process, up to and including departure from the airport. We ensure that travelers' hands are sanitized, and there are a number of sanitizing stations that were erected all around the facility. We also conduct a health assessment for all travelers to include a temperature check. And finally, we ensure the travelers provide confirmation of the health questionnaire and, of course, a negative PCR test result. And both of these, a hard copy is required. But our task is not quite finished there. We play a critical role at the community level as well. Officers are required to monitor businesses which are operational to verify that they are adhering to the guidelines and protocols established by the Ministry of Health. Failure to do so will result in the closure of these facilities. And just by way of information, special protocols were developed for the reopening of entities such as restaurants, supermarkets, salons, barbershops, bars, gyms, and gaming houses. We also have to monitor travelers who are self-quarantined at home, and again, that is to confirm that the quarantine order is being adhered to. This, of course, is in an effort to mitigate the spread of the virus. Of course, to complement these comprehensive actions to manage COVID-19 is the fundamental pillar of informing, engaging, listening to, and educating our communities. Officers have been facilitating education sessions at various localities throughout the island. Also, we have partnered with entities such as the Discover Dominica Authority to conduct training with stakeholders within the tourism industry. It has been almost 8 months since the declaration of this global health emergency, and the COVID-19 pandemic is proving that health is not a reward for development, but rather a foundation for social, economic, and political stability that should be the center of our development. With that said, let me commend my colleagues and the rest of primary healthcare. It is not an easy task. And also to remind the rest of Dominica to continue to follow the Ministry of Health and New Investments protocols so that we can safely continue to navigate successfully through this ordeal. Thank you.
And special thanks to Mr. Ray Robinson, Environmental Health Officer. I would like to echo his sentiments this evening to all the members of the Environmental Health Department. They are some of the first points of contact for travelers, and that puts them at a high risk. So we appreciate your hard work and your dedication. Ladies and gentlemen, that takes us to the end of this evening's press briefing, but before that, just a few reminders. We remain at 2 active cases here in Dominica. For those of you wishing to come in, the website to access the health questionnaire, domcovid19.dominica.gov.dm. That's domcovid19.dominica.gov.dm. I would further like to encourage everyone to be mindful of the things that you spread, be mindful of the things that you circulate. We hear rumors, we continue to hear rumors. We've heard rumors from day one of this pandemic. So we ask that instead of circulating the negativity, instead of circulating things that cannot be confirmed, let us circulate the information that is given here. Dr. Ahmed presented the statistics. Circulate that. Again, we wish to advise everyone that the public health and safety measures should be adhered to. The hand washing, respiratory etiquette, sanitization, the physical distancing, and of course, the wearing of masks. Those are the ways that we've been able to, for the most part, keep COVID-19 at bay. Let us continue to exercise caution. Good evening, everybody, and thank you for joining us.